Hello, my name is Antonia Genath, and I would like to present first results of our study Druckhaft on viral hepatitis and HIV among people who use drugs in a German prison. Viral hepatitis and HIV remain major public health challenges globally, but the burden is not evenly distributed. It is rather concentrated in key populations such as people who use drugs and people in prison. For example, in Germany, prevalence for all three infections in the general population is below 0.3%, but it is assumed to be up to 50 times higher for the prison population, especially for hepatitis C. Additionally, these key populations often overlap, as drug use can lead to repeated incarcerations in many countries, also in Germany. And as people are moving between prison and community settings, this can then further facilitate the onward transmission. For these reasons, prisons are considered key settings for infectious disease control and for reaching the WHO elimination goals, but prevention, testing, and treatment remain limited in many prisons. So what does the situation in German prisons look like? There are around 170 prisons that house up to 60,000 people at any given time, of which the majority are male and many have a history of drug use. In Germany, health insurance is generally mandatory, but people in prison lose their statutory health insurance status, and healthcare is instead provided and also financed within the prison system. And as this is organized at federal state level, healthcare also varies across states. And as a result, there's no systematic nationwide screening to generate reliable prevalence data, and also data on testing and treatment is fragmented, highlighting the need for real-world data on infection prevalence and access to care in prisons as a basis for adapted interventions. And to generate some of the needed data, we wanted to assess three key aspects of viral hepatitis and HIV among people who use drugs in the prison setting. First, the prevalence of hepatitis B, C, and HIV in this population. Second, the access to treatment and testing during incarceration, and factors associated with infection. We conducted a cross-sectional study in June 2025 in a prison in the north of Germany, more specifically the prison Bremen-Oslepshausen, which is the only prison in the federal state of Bremen. It houses around 700 people, including all genders and age groups and all types of detention. Adults reporting current or past drug use were eligible. Participation was voluntary. Participants received a small non-cash incentive, and we obtained written informed consent before data collection. We tested dried blood spots for markers of hepatitis B, C, and HIV, and we used interviewer-assisted questionnaires to collect data on sociodemographics, drug use, history, incarceration experience, and prior testing and treatment. We estimated infection prevalence and testing and treatment coverage as proportions, and factors associated with infection were assessed using univariable post-war regression. In total, 159 participants were included. The majority were male, and the median age was 36 years. About half were born in Germany, and most reported good German language skills and rather high school degrees. But at the same time, social vulnerability was common, including homelessness and a lack of health insurance before entering the prison. All participants reported drug use, but 58% ever injected, with a median age of 23 years at first injection. And of those, 19% injected also during incarceration, and 54% were currently on opioid agonist therapy in prison. Participants mostly had histories of multiple but rather short incarcerations, resulting in a rather long median cumulative incarceration time of 7 years. We found a high infection prevalence in this population. about 18% were ever infected with hepatitis B, and 3.7% had current infection with hepatitis B. Hepatitis C was even more common. Over 1/3 of participants were ever infected, and 18.5% had active infection. And HIV prevalence was 3.2%, meaning that all three infections were substantially more prevalent than in the general population, where, as a reminder, prevalence was below 0.3%. When looking at prior awareness of infection, none of the participants with current hepatitis B and only 60% of those with hepatitis C knew their status, whereas 80% of those with HIV were aware of their infection. Testing coverage during the current incarceration is displayed in green here, and it was limited. Only about 9% of participants reported hepatitis B testing prior to the study. And for hepatitis C and HIV, testing was a bit higher, but still limited at around 21 and 19%. When looking at testing coverage before current incarceration, which is displayed in blue here, we can see that testing coverage, especially for hepatitis B and HIV, was already low before the current incarceration, suggesting that this population might have been underserved already before entering the prison. When looking at treatment among participants who knew of a past or current infection, we saw that fewer than half ever received treatment for hepatitis B and C, which is well below the WHO target of treating 80% of eligible individuals. But especially during the current incarceration, none or only 4 participants received treatment. And in contrast, all participants with known HIV reported receiving treatment both before but also during the current incarceration. We also examined factors associated with infection status, and for time reasons, I will focus on hepatitis C as an example today. And this forest plot shows the prevalence ratio on the x-axis, with values above 1 indicating a higher likelihood of infection. And we found that participants with more frequent and longer incarceration histories, those reporting injecting drug use and sharing of consumption materials like needles, spoons, or straws, particular in the prison setting, and those receiving tattoos in prison had a significantly higher likelihood of hepatitis C infection. So in summary, we identified a high burden of hepatitis B, C, and HIV among people who use drugs in this German prison. At the same time, testing and treatment coverage were limited, both during incarceration, but also prior to it. And we observed ongoing risk behaviors in prison that were associated with infection. These findings highlight a missed public health opportunity to address existing gaps in care in this key intervention setting. And we need to strengthen systematic screening, treatment access, and harm reduction interventions like needle exchange programs or safer tattooing in prisons to fully use this opportunity and to improve health outcomes for a highly affected and probably already underserved population. And with that, I would like to thank you for your attention. I would also like to thank all members of the study and supervision team at RKI, and of course, all participants and staff at the Bremen prison. Thank you.